we start out with the current fellows, with what attracted them to the cardiovascular medicine fellowship here? Now you stayed here on, and what kept you at Stanford?
So I was a resident here, and then I did a chief resident here as well. And honestly, Stanford was easily at the top of my list when looking for fellowships. And it's a great place because it's a unique combination of really strong research environment, really rigorous clinical training, a community that's very close and allows people to lean on each other pretty well, and leadership that's incredibly supportive and collaborative, and has their pulse on the fellowship program really closely. Such a pleasant environment to be in that also allows professional development in a really rigorous manner. So sort of an easy choice.
Let's talk a little bit about the clinical experience that you had as a fellow during your first 2 years.
Absolutely. So our fellowship is heavily clinical, certainly for the first year, but overall for the first 2 years, followed by the third year that's mostly research. And the clinical volume is actually fairly rigorous without being incredibly overwhelming. We have a brand new hospital, which is very beautiful, but has increased our clinical volume quite significantly and the complexity of our patients quite significantly. So as fellows, we get to be on the front lines in terms of taking care of these patients. And I will say one thing about our catchment and our patient population. Even though we're in Palo Alto, we're close to East Palo Alto. Our catchment area spans multiple counties. We see an incredible diversity of patients, including along racial ethnic lines, but also socioeconomic status. We have one of the largest Vietnamese populations outside of Vietnam, one of the largest Tongan populations outside of Tonga. So the exposure we get is quite diverse. And when we combine this patient volume with this diversity and the complexity of cardiovascular disease that we see, it just makes for an incredibly educational and rigorous program over the first 2 years. That certainly made me feel like I was prepared to handle anything from a cardiac standpoint moving ahead. And I will add that our echo lab is very busy. Mm-hmm. Our structural volume is growing incredibly well. As second-year fellows, we get to be first assistant on structural cases like TAVRs and MitraClips at the Palo Alto VA. We get to do as many TEEs as the heart desires because of our echo lab. And we get to do PCIs as second-year fellows as the first operator at the Palo Alto VA. These are just some concrete examples of really how busy and how rigorous our clinical time is and how well-trained we end up being, especially when it comes to patient volume and number of procedures.
Yeah, let's pick up a little bit there. You mentioned the Palo Alto VA. You know, we're incredibly lucky that there's going to be a leadership there, including Paul Heidenreich as chief of medicine, and then our own Dr. Bill Fearon moving over there to be chief of cardiology. Talk a little bit about the experience at the Palo Alto VA for the fellows.
Yeah, absolutely. So I think anyone who's worked at a VA knows it's such a unique population. It's an incredible joy to take care of veterans. But from a medical standpoint too, there's this incredible burden of cardiovascular disease and cardiovascular risk factors in the veteran population that makes for this very enriched and concentrated training experience when we're at the VA. So we have the opportunity to work at the Palo Alto VA, which is really one of the preeminent VAs in the country, very strong research enterprise, but also huge catchment area, very complex patient population. And cardiology fellows are at the front lines in taking care of those patients on the consult service, in the echo lab, certainly in the cath lab and the EP lab, where we get to be first operators most of the time. And the leadership at the VA is very in tune with the fellowship program. Paul Heidenreich is the new chief of medical services. Bill Fearon is the new chief of cardiology. So they're incredibly responsive, I anticipate, to fellow needs. So it's such an incredible core aspect, I would say, of our training program, not just in terms of, again, the joy of taking care of veterans and the complexity and the volume that we get there, but also in terms of the autonomy and the freedom we get to practice our clinical skills at the VA compared with Stanford. And having these two diverse environments to work in, it can only enhance, one's clinical training. Yeah. So I'm a huge fan of the Palo Alto VA.
Tell us a little about the projects you're going to be working on as a third year and how you've been supported and your mentors.
No, absolutely. Yeah, I've been incredibly lucky to have an array of mentors, right, starting from when I was an intern, including you, Dr. Knowles, when I was certainly when I was a resident. And some of the projects I'm working on right now, I think encapsulate what I think my research interests are going to be moving forward, which is, as you mentioned, centered on preventive cardiology, specifically on atherosclerotic cardiovascular disease and ASCVD risk factors through the lens of health inequities, through the lens of novel methodologies, and through the lens of digital health and mobile health. So I'm working with Dr. Fatima Rodriguez on a few projects that center on these topics, using techniques like machine learning to try to optimize ASCVD risk prediction and ASCVD risk factor management at a population level and try to address health inequities and disparities in this space. Dr. Rodriguez, as everyone at Stanford knows, is an incredible mentor, and I'm really lucky to be working with her. I also work with Dr. Ken Mahaffey, who's our Vice Chair of Clinical Research and the head of the Stanford Center for Clinical Research here, on supplementing my interest in clinical trials and the cardiometabolic space centered on diabetes. We have this incredible opportunity to get access to these unique clinical trial databases through Dr. Mahaffey. And my interest in diabetes and my interest in therapies such as SGLT2 inhibitors or GLP-1 receptor agonists has grown exponentially working with Dr. Mahaffey on some of these unique novel clinical trial databases such as the Canvas program analysis and Credence. Mm-hmm. And finally, more recently, I've developed a strong interest methodologically in digital health as a way to address ASCVD and preventive cardiology problems. And I'm fortunate enough now to have to be on an AHA grant, the Health Tech and Innovation Grant, which is through an SFRN grant that Stanford received, a strategically funded research network grant administered through the Center of Digital Health here. So I'm working under the mentorship of Dr. Mintu Turakia, who, again, is a leader in digital health and wearables and clinical trials in that space, notably the Apple Heart Study. So these mentors and these projects have been absolutely incredible. And as part of my research here this year, I'm very happy to be able to immerse myself into these projects. In addition to that, I will say, Dr. David Marin, who's the chief of preventive cardiology here, and the chief of the Stanford Prevention Research Center, you, Dr. Knowles, have been great research and career mentors to me over the past few years. Dr. Bill Fearon, who's my clinic mentor, has been an incredible career and life mentor on how to design a career in academic cardiology. So Stanford is this incredible place where you can assemble a team of mentors and sponsors who can really help sort of a green researcher like me grow into a more mature product and get some really good advice along the way.
You're also not only a mentee, but you're learning to be a mentor. You're one of our chief fellows. You do a lot of teaching. Talk about the role that the fellows have in teaching other fellows and how that helps your skill set grow.
It's one of those classic cliches, I guess, right? You don't want to be the smartest person in the room. If you are, you're in the wrong room. I find that to be constantly true with my co-fellows. I think we learn the most from each other. We have this incredible community where all the fellows lean on each other, informally teach each other all the time. We have text message groups, WhatsApp groups, etc., where we crowdsource challenging cases and questions and tips and tricks for fellowship. But beyond that, we also formally teach each other. We have regular weekly teaching sessions where the chief residents lead teaching sessions. We have CCU case conferences where second-year fellows lead first-year fellows through challenging CCU cases and how to approach those cases under faculty supervision. So we have this incredible community of fellows that lean on each other, that know that fellowship is a zero-sum game, that everyone's in it together, everyone's got skin in the game. They all own the program, nobody rents the program. And these are people who I think have contributed the absolute most to my growth as a cardiologist.
Yeah,
so it's right. An incredible environment to be in.
Yeah, we're very lucky to have outstanding fellows, and your particular class really stands out to me because you really were on the forefront of the COVID pandemic in the clinical year. Tell us a little bit about how you guys survived that and thrived really despite that.
Yeah, I think this year has been challenging in many ways, and certainly because of the COVID pandemic. First thing I'll say is I think the program leadership and the chief fellows last year deserve an incredible amount of credit for how they led from the forefront, including you, Dr. Knowles. There was this tone set right at the beginning that there were challenges ahead with COVID, that we were going to respond to it in a responsible and professional manner to take care of patients, but also to take care of the well-being of the fellows. That fellows weren't being thrown at the front lines in an irresponsible manner. We were able to get through what has been a very challenging clinical year in many ways. I think because of the tone and the leadership set by the program leadership and the chief fellows.
You're also a strong proponent of the Bay Area. You like the Bay Area. Tell us a little bit about why people, should come west or come to the Bay Area.
Absolutely. And I think the picture behind me this is not just a fake background. I bet if I went to campus and took a picture, it would look pretty similar to what's behind me right now. The weather here is incredible all year round. And I say that because it actually does make a difference when you walk out of a 24-hour, 28-hour shift, you walk out to a sunny day with trees around you. It makes a difference to quality of life. The Bay Area offers this incredible geographic diversity, which I am a huge fan of with my wife. The beach is 45 minutes west. There are these lush rainforests that you can drive to within 45 minutes. There are areas that are more desert-like and open that you can drive to in 45 minutes. Drive 2 hours south, you're in Big Sur, which is one of the most beautiful places on earth. Drive 2 hours north, you're in Marin County, which is one of the most beautiful places on earth. And this is just such an incredible place for quality of life between busy shifts. And most importantly, you're surrounded by brilliant people. Even at Stanford, we're surrounded by one of the top engineering schools in the world, one of the top computer science schools in the world. So an incredible startup environment. So no matter what your interests are, even if they're not traditional, there are places you can reach out to immediately if you're in the Bay Area.
Yeah.
So I mean, where else would we want to be?
I've really hit on the questions that I wanted to ask you. Is there anything else that you wanted to talk about?
I think maybe what I would say sort of in the end is, I think fellowship here has been incredible in a large part because it's not about a single thing. It's not just about research, not just about clinical rigor. It's really the combination of all of this. It's about being able to be in a community with incredibly intelligent people without compromising the quality of your research, without compromising the quality of your clinical training, without compromising the weather, without compromising your interests outside of work, your hobbies. Really, it's a little bit of everything here. So that's why it's been such an incredible training program for me and for my whole family. I think I'm very lucky to be part of Stanford.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.